Well, a sad day this morning. The great entertainer Prince dies this morning. He was found dead in his home at age 57. He had flu symptoms, quote unquote. I'm assuming that means vomiting and diarrhea and that sort of stuff at a concert in Atlanta, Georgia, and he canceled it and was flying back home. He forced his plane to take an emergency unscheduled landing in Moline, Illinois, and after 3 hours, the hospital there released him with sort of symptomatic treatments of the flu. I'm assuming dehydration, that kind of stuff. And then this morning, he was found dead in his home at age 57. Now, his top-selling album, of course, was, again, Purple Rain, and he was named Prince, after his father's band, his jazz band. It's kind of interesting. And so it goes back to, here's a guy, extremely wealthy guy, very successful in his chosen profession, dies at age 57, and I suspect he died because the doctors missed something, or they gave him something which killed him, one or the other. And, of course, he's going to have an autopsy of the state medical examiner, and his cause of death will be determined, as opposed to he died of the flu. He may have had flu symptoms, again, vomiting and diarrhea, but I guarantee you he didn't die of the flu. At any rate, I want everybody to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. It's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. And it's one of those things that you look for simple stuff to kill people. Was he supplementing with the 90 essential nutrients? Probably not. Did he die of a thrombotic stroke where he had a blood clot in the brain? Did he die of pulmonary embolism where he had a blood clot in the lung, which is not unusual for somebody who has some respiratory problems and are flying under pressurized air? Did he die of a cardiomyopathy heart attack? Let's say when he went to Moline, Illinois for the 3 hours, they gave him an EKG. A cardiomyopathy heart attack, which occurred some hours later, would not show anything on an EKG. Okay? You can do an EKG 3 seconds before you die of a cardiomyopathy heart attack, and it could be perfectly normal. And so, did he die of, again, a coronary thrombosis, blood clot in the coronary artery? And so we'll find out, did he have a bleeding gastric ulcer? Who knows? This will all come out in the autopsy. But dying of the flu probably didn't happen because he was held for 3 hours in Moline, Illinois hospital and then released. Okay, with kind of a take-home, do-it-yourself supportive therapy. Nah, doesn't sound right to me. Somebody like that, he should have been kept at least 24 hours and had other specialists look at him and so forth. And so there's something either didn't happen that should have happened there in Moline, Illinois, or happened that should not have happened, and we'll find out here pretty soon. Well, the reason I'm kind of blithering about Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, I want everybody to do their own physical examinations, okay? You can do them every month for $4.50 each. Do a complete physical examination. Get the same test strips from a pharmacy or a grocery store without a prescription, and do your own physical examination. And the book, Let's Play Doctor, teaches you how to do this. You can do the same physical examination that your doctor will charge you $2,000 for. You can do your own blood pressure. You can do your own pulse. You can do your own weight. You can do your own blood test. You can do your own urine screening test. You can do the equivalent of a colonoscopic exam with what's called an occult blood test or a FIT test, which is a fecal immunochemical test, right? And so these sort of things people need to begin to do themselves. The medical system has failed us terribly. The word is out that our children will be the first generation of Americans that do not live as long as their parents. And that's because the medical system has failed us. If they were doing all the right job, our kids should live to be 120, even though we only live to be in their 70s and 80s, right? And so they have failed us. Our generation will be burying their children unless you do something different. So I urge you to contact your young GV associate, ask for the books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. Wouldn't hurt to throw in my bestseller, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and begin to look at what's going on here. Begin to take control of your life and the life of your family. Do not just hand everybody over in your family, in your workplace, in your neighborhood, in your church, over to the doctor. they have failed us. Their average lifespan, according to their own survey, is 56. Why would you go to any group of people for advice on how to live a long, healthful life who, under their own survey, they said their lifespan is 56? I said it was 58 in the original Dead Doctors Don't Lie audio cassette tape, then CD, then book, then DVD. And everybody laughed at me and said, "Wallach, that can't be right. You got to be lying or stupid or dumb." And then the medical profession did their own survey. They said, "Wallach lied. The average lifespan of medical doctors is not 58 like he says. Our average lifespan was 56. Now, what they wanted to show, as silly that it is, they wanted to show that my science was bad and I didn't get the numbers right. So they were willing to point out that they died 2 years earlier than I said they did. And they don't realize how silly that looks to the general public. Again, get the books Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Add 25 to 50 health years to your life. And oh yeah, better yet, add 25 to 50 healthy years to your kids and your grandkids' life. Well, stick with us. We're going to be back with Dead Doctors Don't Lie after these messages. Okay, Doug, let's do the Pearls of Wisdom here.
All right. Got a CNN story here, headline, people who are lonely, are alone and lonely are at greater risk of heart disease. They say loneliness and social isolation can impact a person's health, ranging from high blood pressure to being overweight, having cognitive decline, even increased risk of dying at a young age. New research has now put a number on how this could affect someone's risk of heart disease and stroke specifically. And researchers at the University of York found that people who were isolated, meaning they had few social conditions or connections, or feel lonely, have a 29% risk of having a higher risk of having a heart disease and a 32% higher risk of having a stroke when compared to their peers who felt they were well connected. They combined data from 23 studies and altogether included over 180,000 people living in high-income countries in North America, Europe, Asia, and Australia. And the studies had assessed the level of isolation and loneliness among the participants and monitored them from anywhere from 3 to 21 years to see whether they developed heart disease or suffered a stroke. The loneliness increased risk of death, research finds. In most cases, it was the participant's first heart attack or stroke. That comes from study lead author Nicole K. Valtoria, and this was all published in the journal Heart. They say research puts loneliness and social connection on par with anxiety as a risk factor for a heart disease and stress at work as a driver of stroke risk. And they go on to say there are many ways that being lonely and isolated can influence the heart and the onset of a variety of diseases. For example, people who are on their own could have worse diets, not exercise or sleep, and they could also be less likely to take medications or go see a doctor. These factors could drive up blood pressure and inflammation, in which turn could lead to heart disease. Previous studies have found that people who are less socially connected and have higher blood pressure as well as higher levels of marker inflammation in the blood, they say being alone and feeling like you are alone probably increases the risk of many diseases. And I thought interesting because that right there is a darn good reason for people to get involved with longevity and start a longevity business, because it is a family people business. And if you're involved in longevity, you're not going to be socially isolated.
You're exactly right. Thank you so much for those great thoughts there, Doug. Actually, we're a Longevity Nation, Longevity family. And again, people always say, how do you stay on the road so long? You know, I'm on the road maybe 320 days out of the year, but everywhere I go, I'm with a Longevity family member, and so I feel very, very well connected and have a family wherever I go. And it's amazing. You can not see people for 6 months or a year or 2 years, and then you meet with them, and it's like being with your brother, your sister, your mom, your dad, depending on their age relationship to you. And the Longevity Nation is a great thing. Not only do we provide information to help people with their health challenges, but as you say, we provide a community. I like to use that. We provide a community. That's why we're called Longevity Nation, to allow people to develop their own program for themselves and to deal with their own health issues, whether they're emotional, physical, biochemical, and everything from infertility to heart disease, diabetes, arthritis, dementias. It's really amazing. When you have a family support, everything is easier. And so you're exactly right, and I can't thank you enough for bringing this out. And again, if people want the history of all this, They need to get a hold of the book, Dead Doctors Don't Lie, the CD, Dead Doctors Don't Lie, and the DVD, Dead Doctors Don't Lie, and learn about the family of longevity and how it all happened, and why it happened, and where we're going. And thank you so much again, Doug. Super job. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Mount Vernon, New York, and Larry, you're on with Dr. Wallach.
Well, Larry, you're on the air.
Okay, Dr. Wallach, how are you doing, sir?
Fine, sir. Thank you. How can we help you?
Okay, listen, Doc, I have your book. I take your supplements and everything.
Okay.
And they have helped me tremendously, but what I'm more concerned about right now is my mother.
Okay.
She's been diagnosed with, with dementia, senile dementia, that's what they call it.
Mm-hmm.
But she's bedridden. She can't walk.
Now, is she at home or is she in a nursing home?
At home.
Okay.
Okay.
Is she having a visiting nurse from Social Security or insurance come and visit her?
Yes. Well,
okay.
As a matter of fact, they just started that like a month ago.
Okay, so you do have a caregiver to make sure she's going to get all her supplements and everything.
Right. Now, I tried to talk to her doctor the other day about supplementation, but it kind of pushed that to the side. I want to ask him about, prescribing something for her. Mm-hmm. So because I have been in the last year, I make sure she gets the liquid minerals
mm-hmm.
and selenium fish oil, but she seems to
Okay, how much does your mom weigh and how old is she?
My mother's 88 years old, and she's upward of, I would say, like
is she bigger than you or smaller than you?
She's quite big.
Is she 200 pounds?
Yeah, she's over 200.
Okay, 250, 300?
I'm 218. Yeah, she's up that way.
250 or more. Okay. All right. Does she have any other issues? Any high blood pressure, diabetes, arthritis?
Okay. They just took a blood test on yesterday. The nurse came in, took a blood test, so we won't get those results for a few days.
But I mean, historically, she hasn't been treated for diabetes or anything like that.
No.
Okay. All right. Well, let's get going here because we only have a little bit of time. We probably won't finish giving you all the information, so hang on after the information. But Shar, what's going on here?
Well, she probably needs to get on a gluten-free diet to help lose weight,
mm-hmm.
and she needs probably two or three healthy brain and heart packs.
Okay. And what else would you add for that?
I would add the Synaptive to it for sure.
And what else would you add for that?
I would add the, just in case, I would add the, blockages and stuff. I would add the Daily, Classic Daily, the Niacin Plus, and the Cardio Sticks.
Okay, very good. So hang on here, Larry. We're going to run to one of those message moments, and we will give you the basic stuff you need. Get your pen and paper ready. And we'll be back with you after these messages. Okay, Doug, let's go right back to New York and Larry. Okay, as Shar said here, Larry, for your mom, what you would do is get her off all the bad stuff. And in her case, it would be also Ensure and Boost. Read the labels. They contain a lot of oil in them as a source of calories. And so this is very bad because they turn into trans fats, heterocyclamines, and acrylamides, which cause inflammation for all tissues, including the brain. And so if she's being fed with a G-tube, you're going to have to put the supplements in milk or water. If she's lactose intolerant, she would have put it in water. If she's not lactose intolerant, I would put it in milk to give her some more nutrition. But she's got to get off of the Boost and off of the Ensure. It's a convenient thing for the nurses and the technicians to get stuff into her, but is not really a good thing. We actually have a wonderful source of nutrition. It's called It's our shake. It's a Slender FX shake, and you can go ahead and mix it with milk, half and half, or heavy whipping cream. If your mom is not lactose intolerant. If she is lactose intolerant, you'll have to use something like, I would go ahead and even use almond milk or rice milk or soy milk as a substitute. But you need some more calories and so forth. Then, as Shar says, a basic program, if she weighs more than 250 pounds, I would give her maybe 10 to 12 eggs a day. They can whip them up and put them in water if she's lactose intolerant. But if she's not lactose intolerant, you can put them in the shake. The eggs are just a wonderful source of nutrients as well as protein, high-quality protein. And again, she could have 8, 10, 12. She could have 25 eggs a day if you can get those into her. That'll be good for her brain to help rebuild her brain. She needs to be off of statin drugs because statin drugs actually reduce the blood cholesterol levels. And, of course, part of your brain, the white matter of the brain, 75% of the brain weight, is almost 100% cholesterol. So at this point in life, we want to get her off of the statin drugs. And let's see here. In addition to the 3 Healthy Brain and Heart Packs, obviously if expenses are outside of your capacity to do that, I'd go with 2. I wouldn't go anywhere less than 2 of the Healthy Brain and Heart Packs. Also, I would throw in the de-stress capsules, 3 of those twice a day in case she's got Korsakoff syndrome, Wernicke-Korsakoff syndrome. That'd be 2 bottles a month of the de-stress capsules. Open them up, put the powder in either the shake or in with the other liquids and pump them in through the G-tube. And then I would also, as Shar said, give her the Ultimate Daily Classic tablets. I'd go ahead and give her 12 a day, 3 times a day. You have to grind them up and put them in some applesauce, which she will take, or grind them up into a fine powder and put them in one of the liquids, including the shake. She should also have at least 2 a day of the Ultimate Cardio Sticks, 1 at breakfast, 1 at dinner. If, again, finances are not a problem, she could have 3, 1 at breakfast, 1 at lunch, 1 at dinner. And then she should have a minimum of 6 of the Ultimate Niacin Plus, 2 at breakfast, 2 at lunch, 2 at dinner. That'll be 3 bottles a month of those, and they help dilate the arteries, including the arteries of the brain, support healthy blood flow into the brain, support healthy blood pressure, as does the Cardio Sticks, as does the Ultimate Daily Classic tablets. And so give us a call every couple of weeks. Let us know how Mom is doing. You can do the DOT thing immediately. And, of course, in New York, it's going to take maybe a week, working days, to get the supplements to you at that end of the country. But you can start the diet change immediately. We'll be back after these messages.
Let's head to Illinois. And Shelley, you're on with Dr. Wallach.
Hello, Shelley. You're on the air.
Hi. I have fibromyalgia, and I started taking a product with fruits and vegetables, and I'm like 90% better. But I have extreme calf pain when I start to exercise, and I didn't know what I could do for the pain in my calves.
Okay. Now, do you have any history of respiratory problems as a kid, bronchitis, asthma?
I did. I was on asthma medicine, but I quit taking it.
Okay. How long were you on asthma medication?
About 3 to 4 months.
Okay. And as a child, did you have any skin problems, any eczema, dermatitis, psoriasis, or dry, itchy skin?
No.
Okay. As an adult?
No.
You have children?
No.
Okay. Brothers and sisters?
Yes.
Okay. Do them have any health problems?
He has like a heart murmur or something like that.
Mm-hmm.
But other than that, he's pretty healthy.
Okay. Nobody's had their appendix out?
No.
Okay. All right. What do you weigh, Shelley?
About 200.
Okay. And how tall are you?
5'3".
Okay, 5'3". I'd like to see you weigh 120, something like that. So we need to lose about 80 pounds. Okay. And so, okay, Shar, what do you think is going on here?
Well, I would guess, even though she doesn't have symptoms, that she's got a gluten problem. That's why the weight and everything.
Exactly. And, of course, fibromyalgia is kind of a cousin disease to lupus and sarcoidosis, and they're all deficiencies of multiples of nutrients. And this can be caused by a malabsorption, as Shar infers there, by malabsorption, even if you're supplementing. And the fact that you went on a fruit and vegetable product, now, did you give up gluten? Did you give up bread and that kind of stuff when you're on this product?
Yeah, I'm 99% gluten-free.
Okay, so that would explain why you're feeling better, and the odds are you do have a gluten problem. So we want you to get gluten-free. I mean, that includes the dog, the cat, the bird, the fish, spouse, mother-in-law, everybody in the family, right? Every renter, anybody living in the household has got to be gluten-free, so there's no cross-contamination in the laundry, the food preparation surfaces, the couches, the beds, and all that kind of stuff. And then, let's see here, what would you do for Shelley, Shar, for the fibromyalgia and the weight challenge?
I would give her 2 healthy bone and joint packs, but then I'd also give her some extra EFAs.
Okay, and what would you do for her muscles?
Give her extra glucogel.
Okay. I'd also add the selenium for the muscle pain kind of stuff and the back pain. Let's see here. So let's, Shar said, let's get you on 2. I'd go with the 2 healthy brain and heart packs per month, full dose of thing twice a day. That's 1 per 100 pounds of body weight. I'd also get 2 large bottles of the glucogel to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, and take 15 of those capsules a day, 5 at breakfast, 5 at lunch, 5 at dinner. 2, let's see, you're going to get the selenium in the healthy brain and heart packs. And then also, for the weight, what would you give her for the weight, Charmaine?
I give her the ASAP.
Absolutely, and I'd go for 2 bottles a month, 2 dropper bottles a month of the ASAP. It's an acronym for as slim as possible, as soon as possible. Put 2 droppers full under your tongue before each meal. 1 dropper full, the first dropper full under your tongue, 30 minutes before each meal. The second dropper full under your tongue, 15 minutes before each meal. And then let these little sort of dropperfuls of liquid be absorbed through oral tissues. Don't swallow it. It won't hurt you if you swallow it, but you won't get maximum benefit. And within days, you should be starting to lose anywhere from a half a pound to 2 pounds a day. That's very typical of this program. And so within a reasonable amount of time, anywhere from 4 to 6 months, you should be able to get down to where you need to be, 120 pounds kind of thing. And wouldn't hurt also, what would you give her topically? What would you give her to put on any sore muscles or joints she has?
I give her the CM cream with some trauma oil put in it.
Very good. You get an A+. So, yep, I'd go ahead and get yourself a couple of bottles, these wide-mouth jars of the CM cream, as for Cat Mary, C for Cat, M for Mary, CM cream, and get at least a couple of these small 10 ml bottles from our Ancient Legacy division or aromatherapy division of the trauma oil, as Shar says. Put 5 or 6 drops of the trauma oil in each teaspoon of the CM cream. Apply it to any muscles or joints, your back, neck, arms, elbows, shoulders, knees, hips, ankles, any place you have discomfort or reduced range of motion because of swelling and inflammation. And this will give relief. And certainly within weeks and months, you're going to see that your body wants to heal itself, and your body will support and promote maintenance repair of cartilage and ligaments and tendons and connective tissue and bone and disc between the vertebrae and muscles and so forth. And so you're going to see some benefit here. And give us a call every couple of weeks. And just getting gluten-free, as Shar said, that's going to help you lose some weight, and also that's going to help you rid yourself of the symptoms because you'll be able to have an increased efficiency of absorption of nutrients. And thank you so much for sharing your story with us, Shelley. Look forward to hearing from you every couple of weeks. And Doug, let's go to callers.
Let's go to New Jersey. And Chris, you're on with Dr. Wallach.
Oh, Chris, you're on the air.
Hi, Doc.
Hi,
Can
Chris.
you hear me?
Yes, ma'am. How can we help you?
Okay. I have a couple of suggestions before I have the topic I would like you to address. You don't respond to the suggestions, just hear them so we can save time.
Okay.
The first is that I'm a new distributor, and I would love it, since Longevity has so many products out now and so many CEO packs, I would love you to consider having 10 flex pays available so that I could order, because I can't do it on my budget right now. I would love to order all the CEO packs and become a CEO, but only have to do over 10 flex pays, and then so I could sample all the products faster, and then only have to do 1 monthly repeat. And then please consider having PayPal as a payment method also. Now, the second suggestion is please address in your opening segment or your segment with Doug domestic violence and how Longevity can help with that. And I would love to know if you've ever had the opportunity to do an autopsy on somebody who committed domestic violence and, like, say, killed their partner, whether it was a male or female that did that. And if somebody is in a domestic violence situation, which I am not, thank God, I just went to a symposium on it, though, and is this something that they could do with longevity that would possibly help them, that they could introduce into their household without the abusive spouse knowing, that would help possibly ameliorate the symptoms? Okay, now the topic that I would like you to address today is interstitial cystitis. I do not have it, but I've recently learned of it, and I think it's so horrifying. And the information, I would love to hear your take on it, what longevity protocol is recommended, and what conditions dovetail into it.
Okay. Stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 90 for Life Crusade. And Doug, let's go right back to New Jersey and Chris. The interstitial cystitis, which is pain on urination, is kind of like a fibromyalgia of the muscles of the urinary bladder is what it is. But I don't know, it's a very high percentage. It could be 75, 80% of the time when people are diagnosed with interstitial cystitis, it's actually a back problem because they have urgency. They'll wake up in the middle of the night. If it's a guy, they'll say at first, oh, you have a prostate problem. And if they deal with that and it doesn't solve the problem, they say, oh, you have interstitial cystitis. If it's a woman, they jump right to either interstitial cystitis or they may talk about UTIs, urinary tract infections. But 75 to 80% of the time, it's a back problem because the same nerves that when they're squeezed coming out from between the lumbar vertebrae, you get peripheral neuropathies, you get sciatica, pain down your hips and legs, and numbness and tingling and burning and all that kind of stuff in your feet and legs. The internal branches of the sciatic nerves also control the bladder, both males and females. So I would also kind of look at that when people are diagnosed with interstitial cystitis. Just because they have a diagnosis of it doesn't mean that that's what it is. That just means the doctor's impression of the symptoms, okay? So I always like to do both things. First of all, I would give per 100 pounds of body weight the Healthy Bone and Joint Pack to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Bone makes the bone itself. I would also get some CM cream and trauma oil to put on the lumbar area of the back. And this is going to give symptomatic relief by reducing the inflammation and swelling around the roots of those spinal nerves in the lumbar area. And oftentimes, when you lay down, these symptoms are worse. That's why people get up in the middle of the night to go to the bathroom and so forth. They have incontinence and they wet their pants and they have to wear Depends and all these kind of things because it's a back problem squeezing the spinal nerves in the lumbar area which control the bladder. Okay, so I like to come at it, as they say, both directions. Let's see, we got enough time here. Yeah, Shar, what would you do for somebody that has peripheral neuropathies, whether it's sciatica down the legs and hips or loss of control of the bladder?
Then you get on a Healthy Bone and Joint Pack.
Absolutely, A+. It's a 1 per 100 pounds of body weight, and I get an extra bottle of the glucogel, so you can take a minimum of 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner, 2 bottles a month of the CM cream, and a couple of these little 10 ml bottles of the trauma oil, and apply that to the back. And then, of course, in case there is a UTI, urinary tract infection, what would you do? What would you give?
I give them the Killer Biotic and
there you go.
Cranberry juice.
There you go. Killer Biotic, absolutely. And it'd be 3 of those twice a day per 100 pounds of body weight, 2 bottles a month to actually support the immune system. And 2 of the herbs in the Killer Biotic actually have antimicrobial properties. And then also, in case, like I say, in case there's infection in there, or it is rarely, but it is a interstitial cystitis, what would you do to support, what mineral would you give to support the muscle health of the urinary bladder?
I mean, what mineral?
What mineral?
Of the bladder?
Okay, got to get to another call. Be selenium. We've got to run to another call here, so let's go to another call.
Let's head to California. And Terry, you're on with Dr. Wallach.
Okay, Carrie in California. We only have a few minutes, kiddo. What do you got?
Hello?
Hi. Yeah, we got to go. What do you got?
Okay, I have a 7-year-old dog. He's got a second tumor, but they won't do an operation because his enzyme counts at 1,600 instead of like 12.
What kind of tumor?
It's a fast-moving tumor. He had one removed about a year and a half ago.
No, are we talking about in the skin, the throat, the tongue, the eye? I mean,
on the skin.
Okay, so it's a malignant tumor. Is that correct?
Yes.
Okay.
Yes.
All right. What does a dog weigh, you say?
About 14 pounds, 15
14 pounds. Okay. So what would you give this 14-pound dog, Shar?
I'd give him Arthrodex, and for tumors and stuff, I put some extra selenium and stuff in it.
Now, you want to make sure you're giving it a dog food designed for a 14-pound toy dog, and then throw in, as Shar said, the Arthrodex. It would be a half a scoop per day, and then throw in some extra selenium. And wouldn't hurt to throw in some Z-Radical. Give him a half a tablespoon of Z-Radical twice a day. Let us know how it goes. And thank you so much, Shar. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
We've all heard the term baby boomer referring to those born from 1946 to 1964. There are an estimated 80 million baby boomers, with the first wave hitting the Social Security and Medicare systems in recent years, with more to follow. Many healthcare experts are predicting epidemics of Alzheimer's, type 2 diabetes, heart disease, and cancer among this group. However, these impending epidemics can be averted, as there is a new group emerging. This group we call the baby bloomers, because despite their chronological age, they are still physically fit, active, working, and playing. They've heard Dr. Wallach's message regarding diet, lifestyle, and nutritional supplementation. So while many around them diminish in health and vitality, they are blossoming and blooming into vibrant, healthy, on-the-go people. Wouldn't you rather be a longevity baby bloomer? If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Longevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels, a formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium, all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Longevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. 314-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewable, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. Imagine a rich, decadent chocolate that's actually good for you. Youngevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture, with 80% reaching the intestines, which is much more than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Youngevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.